Today, we're going to take a trip deep inside the human body to really get a handle on one of the world's biggest health challenges, heart disease. We're going to find out how it starts, learn how to spot it, and this is the most important part, we'll explore how we can fight back.
Just take a second and think about that. What if? This isn't just some hypothetical question, you know. For millions and millions of people, it's the reality of heart disease. It's often called the silent killer for a reason. It can build up slowly over decades with zero obvious signs until, well, something serious happens. And that is exactly why we need to understand where it all begins.
So, here's our game plan for this explainer. First, we'll look at those silent beginnings. Then, we're going to learn how to decode the signals our own bodies are sending us. After that, we'll cover the 3 main ways to fight back, and we'll wrap it all up by talking about the incredible power of prevention.
All right, let's dive into our first section. The big question is, how in the world does a condition this serious manage to start without making a peep? The answer, it turns out, starts deep inside our blood vessels.
First things first, let's get our terms straight. Heart disease isn't just one single thing. It's actually a big umbrella term for a bunch of issues that affect the heart and blood vessels, which is why it's such a major health concern around the globe. And the most common type of all is something called coronary artery disease. You can basically think of this as a problem with the body's plumbing, specifically the pipes that supply blood to the heart muscle itself.
And this right here shows you the core problem perfectly. Okay, so everything starts with a healthy artery. Picture a clean, open highway where blood can just flow freely. But over time, things like extra fats and cholesterol start to get sticky, and they begin clinging to the inner walls. It's kind of like a slow-motion traffic jam starting to form. This sticky gunk is called plaque. And as it grows and hardens, it narrows that highway, slowly choking off the vital blood flow. And yep, this whole messy process has a name, atherosclerosis.
So what causes this plaque to start building up in the first place? Well, it's usually a team effort, a combination of factors. High blood pressure, for example, is like a constant stress on those artery walls, creating these tiny little injuries. Then, high cholesterol comes along and provides the perfect sticky material for plaque to form right in those spots. And certain lifestyle choices like smoking or an unhealthy diet, well, they basically just hit the accelerator on the entire process.
And here is the absolute key takeaway from all of this. This entire process of plaque building up can happen for years with absolutely no symptoms. You can feel perfectly fine on the outside, while your arteries are slowly but surely narrowing on the inside. This is the silent danger of heart disease.
So, if the beginning is totally silent, how are we supposed to know if something's wrong? Well, we have to learn to listen. We have to learn to decode our body's signals, which can start as quiet little whispers before they turn into loud alarms.
Let's start with those whispers. These are these subtle little signs that are just so easy to dismiss, right? Feeling unusually tired? Oh, I just had a long week. A little out of breath after climbing the stairs? I guess I'm just out of shape. But these common excuses could actually be masking your heart's very first cry for help, its first indication that it's not getting enough oxygen-rich blood.
And you can see the progression so clearly here. Those whispers of fatigue or a little discomfort can eventually escalate into loud, blaring alarms. We're talking severe chest pain, what doctors call angina, or even pain that spreads out into your neck, your jaw, or down your arm. This is no longer a whisper. This is your body shouting that there is a serious problem.
And beyond just chest pain, there are other signals you have to watch for. I mean, it makes sense, right? If the heart can't pump blood the way it should, fluid can start to build up, and that often causes swelling in the legs and ankles. You might also feel nauseous or notice a weird coldness in your limbs. These are all signs that reduced blood flow is starting to affect your entire body.
Okay, now this is critically important. If you or anyone you are with ever experiences these symptoms, we're talking crushing chest pain, a sudden inability to breathe, or fainting, this is an emergency. These are the classic signs of a heart attack. You need to get medical help immediately. Do not wait. This is not a wait-and-see situation.
Okay, we've seen how heart disease gets started and what signals to look for. Now for the good news, the empowering part, how we fight back. There are 3 main lines of defense we can use. The very first line of defense is the foundation for absolutely everything else, and it's where you have the most control. A heart-healthy diet, regular physical activity, quitting smoking, these aren't just nice suggestions. They are incredibly powerful tools. They can actually slow, stop, or in some cases even begin to reverse that plaque buildup in your arteries.
Now, the second line of defense involves medication. Sometimes lifestyle changes just aren't quite enough on their own.
And that's when doctors can prescribe medicines to help get those key risk factors under control. These drugs can do things like lower your blood pressure, reduce cholesterol, prevent dangerous blood clots, and help keep the heart's rhythm nice and steady.
And for the more advanced cases, there's a third line of defense: medical procedures and surgery. For instance, doctors can perform something called an angioplasty. That's where they thread a tiny balloon inside a blocked artery, inflate it to push the plaque aside, and really open things up. They often place a tiny mesh tube called a stent in there to help keep it open. And in the most severe cases, bypass surgery can be used to basically create a whole new route for blood to flow around the blockages entirely.
And that brings us to our final and, arguably the most important section. Because while all those modern treatments are incredible, prevention is always the best medicine. So let's talk about how you can take control of your heart health right from the very beginning.
Does this look a little familiar? It should. Your prevention toolkit contains the exact same lifestyle changes we were just talking about for treatment. And that right there is the key insight. The things that help manage heart disease are the exact same things that prevent it from ever starting. Eating well, moving your body, avoiding tobacco, getting regular checkups, these are the absolute cornerstones of a healthy heart for life.
Seriously, if you take away just one single thing from our time together today, let it be this. You have an incredible amount of power to protect your own heart. Prevention is, without a doubt, your absolute best defense.
So I'll just leave you with this question. And remember, this doesn't have to be some massive overnight life overhaul. Not at all. Maybe it's just taking a walk during your lunch break. Or maybe it's swapping one sugary drink for a glass of water. Just think about it. What is one small, totally achievable change you can make for your heart starting this week? Thanks so much for joining me.